We are starting with individual lesions now. The first on our list in the oral cavity is the irritation fibroma. This is the most common feature. It is painless. It is a reactive proliferation of fibrous tissue. So it is reactive, so means it is reacting to something. So what it is reacting to? It is reacting to trauma, which can either be due to teeth or due to dentures. So because of this, the most common site will be the lateral tongue, which is subject to the teeth and dentures, and the mucosa along the bite line. So grossly they are pink or white in color. We will see the clinical differentials later. It is white in cases where it is trauma related and results in hyperkeratosis. In that case, it will appear as white. These are dome shaped and they are few mm in maximum diameter. Now on microscopy, they are nodular depositions of dense collagen. So as we can see in this diagram, the pink lines that we see here are the dense collagen. The overlying mucosa is thinned, as we can see that the mucosa is not dipping inside. This is also called as the atrophic epithelium. It is also showing features of parakeratosis. As we can see, the nuclei here are nucleated even on the surface. There will be chronic inflammatory cells here and the fibroblasts are spindle. However, if the fibroblasts are large and stellate, the lesion will be called a giant cell fibroma. This is not associated with trauma and it also recurs after resection. Now we'll take a look at the key histological differentials, which are also the spindle cell lookalikes. So all these lesions will have spindle cells in them. Now we'll see how to differentiate among the following. The first is the giant cell fibroma. Like I already mentioned, they will have large stellate fibroblasts. However, they are often multinucleated, which are absent in irritation fibroma. Next is the neurofibroma. It will be more cellular. It will have wavy serpentine nuclei. Next is the traumatic neuroma. This is a very important differential. It can be differentiated clinically because traumatic neuroma is painful. However, the irritation fibroma is painless. It will show disorganized proliferation of small nerve fascicles, Schwann cells and fibroblasts. Next is the schwannoma, which is encapsulated and shows the classic biphasic pattern. The three which are of the nerve cell origin, that is the neurofibroma, the traumatic neuroma and the schwannoma, are all S100 positive. Now we'll also take a look at the important clinical differentials which are very easy to rule out on histopath. So the first one is the lobular capillary hemangioma, which is not fibrous, it is a vascular lesion. Next is the mucocele. It shows pools of mucin, macrophages and granulation tissue. Very easy to rule out on histopath. Next is the lipoma, which is of course made up of mature adipocytes. One interesting topic is that leukoplakia. One important thing to consider is that irritation fibroma appears white if the surface has thickened due to irritation and due to chronic biting of the neuroma. However, on histopathology, they are very easy to differentiate because leukoplakia is pathology in the epithelium. So in this, we can see hyperkeratosis with or without acanthosis and dysplasia, and leukoplakia presents as a patch. However, in cases of the irritation fibroma, the pathology is in the connective tissue and most commonly it forms a lump.